All right, ready for a deep dive into something I bet we've all experienced at some point, or at least know someone who has ankle sprains and tears.
Ugh. Yeah, the worst.
But the cool thing about this deep dive is our main source is actually an Arabic guide.
Oh,
So
wow.
we're getting a totally fresh perspective on this super common injury.
Cool.
So even if you think you know it all when it comes to ankles, get ready for some surprises.
I'm ready.
Yeah, I think what I found so interesting is how this Arabic perspective really emphasizes, like, knowing how bad the sprain actually is, because
All right.
we tend to just lump all ankle sprains together,
Yeah.
but they can be anything from mild to, like, super severe, and obviously that's going to
Yes.
affect how long it takes to recover.
Makes sense.
Yeah,
Yeah.
totally. I remember this one time I twisted my ankle playing basketball, and I was like, whatever, it's fine. But then later, I realized I should have, like, actually taken it seriously.
Oh, for sure.
Lesson learned, right?
Yeah, you live and you learn.
Exactly.
For sure.
So hopefully this guide will help us all avoid those mistakes.
Definitely.
It actually uses the term age is sick,
Wow.
and that's pronounced iltiwa al-coil to describe a sprain.
Yeah.
Basically what happens is those ligaments that support your ankle, those tough bands of tissue, they get stretched or sometimes even torn. Ouch.
Yeah, and so many people think sprains only happen when you're doing something super intense like sports.
Right, right.
But this guide actually points out some everyday stuff that's just as risky.
Okay, like what? Give us the rundown so we know what to watch out for.
Well, just walking or running on uneven surfaces like a bumpy trail or even
Oh, yeah.
like a sidewalk crack you don't see, that can totally do it.
Oh, for sure. I mean, those hidden dangers are everywhere.
Right. They're sneaky.
Yeah, totally.
And here's something I found super interesting in the guide.
Okay, hit me.
Both weak ankles and overly inflexible ankles can actually make you more likely to sprain your ankle.
Wait, really?
Yeah.
That seems kind of counterintuitive, right?
Right. You'd think.
Strong ankles should be, like, less prone to injury, no.
Well, it turns out that having too much or too little flexibility can actually make your ankle, like, more vulnerable. Think about it this way. A stiff ankle doesn't have that range of motion to adapt to sudden changes in terrain, so it's easier to roll.
That makes sense.
And then on the flip side, a weak ankle doesn't have the strength to really support your body weight, especially when you're moving quickly. And so you get instability and boom, potential sprain.
So it's all about finding that sweet spot.
Yeah, exactly.
Like the perfect balance of strength and flexibility.
Yep, gotta have both.
Got it. Okay. So note to self, focus on both strengthening and stretching those ankles.
For sure.
Now, before we dive too deep into prevention,
Okay.
let's talk about actually recognizing a sprain, What should we be looking out for?
Well, the guide emphasizes paying attention to how you feel. So, like pain, especially when you touch the injured area, try to move it or put weight on it.
Right.
That's usually a big red flag.
Yeah, I mean, pain's a pretty good indicator that something's wrong.
Exactly.
Howdy.
You might also notice the area feels warm and there's some swelling too. That's your body basically starting the repair process, increasing blood flow to that area.
So those annoying symptoms are actually a good sign.
Yeah, it's like your body's own first aid kit kicking into gear.
Interesting.
Now imagine you're trying to walk with that ankle and with every step it feels like it could just give way. That's a pretty clear sign you might have a sprain.
Yeah, no thanks.
Yeah.
So we know what causes sprains. We know the telltale signs.
Mm-hmm.
Now let's talk treatment. I'm assuming what you do depends on how bad the sprain is, right?
You got it. The guide does a fantastic job breaking this down.
Okay, good.
For those mild sprains, where you might be a little uncomfortable, but you can still walk. Okay. The focus is on self-care using the RICE method.
Yes, RICE.
Everyone's heard of it.
We've all heard of it, but honestly, I think it's worth unpacking what it actually means.
Oh, for sure.
Yeah, just as a refresher.
Absolutely.
So what does RICE actually stand for, and why is each element important?
Okay, so RICE stands for rest, ice, compression, and elevation.
Got it.
Rest, pretty self-explanatory. You want to avoid anything that puts stress on that ankle.
Right.
Give those ligaments a chance to heal without any more strain.
Okay, so rest is all about minimizing damage. Got it. What about ice?
Ice is key for bringing down inflammation and pain. Applying an ice pack for 15-20 minutes every 2-3 hours, especially in those first few days after the injury, can make a huge difference.
Okay, Good to know.
But there's actually been some recent research
Oh,
that's kind of questioning the long-term benefits of ice, like
interesting.
suggesting that in some cases it might actually delay healing.
Hmm.
It's a bit of a debate in the medical community right now.
So ice might just be a temporary fix for the pain, but we shouldn't overdo it.
That seems to be the current thinking, yeah. But as always, with any medical advice, best to chat with your doctor or physical therapist to see what's right for you.
Sound advice. Sound advice.
Always good to double check.
Now, what about compression? What's the purpose of that?
Compression, which you usually do with an elastic bandage, helps to control swelling and support that injured ankle. It's basically like an external brace, helping to stabilize things.
Gotcha. That makes sense.
And finally, we have elevation.
Okay, what's the thinking there?
Gravity, my friend, gravity.
I should know.
By keeping your ankle raised above your heart, you're helping to reduce swelling because it encourages fluids to drain away from the injured area.
Oh, so it's like giving those fluids an easier path back to the rest of the body.
Exactly. And of course, don't forget about those over-the-counter pain relievers.
Oh, right, right.
Managing pain is super important for recovery, and it can make you feel a lot more comfortable as you heal.
Yeah, for sure. Being comfortable definitely helps you stay positive and motivated during recovery. But what about those cases where rice and over-the-counter meds just aren't cutting it?
Right.
When do you bring in the big guns, like physical therapy?
That's where CNCAC comes in.
Okay.
It's pronounced alaj tabi, and it means physical therapy.
Okay.
The guide really stresses how important this is, especially for those moderate to severe sprains. Think of it like your roadmap to getting your strength, flexibility, and stability back in that ankle after an injury.
So you're not just resting and letting it heal on its own. You got to actively work those muscles and ligaments back to their full potential.
You got it.
And I'm guessing the type of physical therapy varies depending on how bad the sprain is.
Exactly. For some people, it might just be some simple range of motion exercises and stretches, to prevent stiffness. But for others, it could involve more advanced exercises with weights and resistance bands to really rebuild that strength and stability.
So it's totally personalized, tailored to your needs and recovery goals.
Exactly. Spot on.
And I'm guessing, depending on how bad it is, you might need some extra support too, like crutches or a brace.
Yeah, for sure. Things like crutches, bandages, maybe even a brace can all help stabilize your ankle as it heals.
Got it. So those support devices can really make a difference in terms of comfort and mobility while you're recovering.
Huge difference.
Okay. Now, I know surgery is also an option for some ankle injuries. So where does that fit into the picture?
That's a great question, and I think one that a lot of people are curious about. Surgery is usually reserved for the most severe cases.
Okay.
Like when the ligaments are completely torn.
Wow.
Or if other treatments haven't worked.
So it's not the first line of defense, but it's important to know it's an option if you need it.
Exactly.
Okay.
Good to know.
While physical therapy is often really effective, there are times when surgery might be necessary to repair a really badly damaged ligament, or if there are complications that haven't responded to other treatments.
I see. So it really depends on the individual situation.
It does. Well, I think a lot of people listening are probably wondering, okay, when should I actually see a doctor about this? Like, what are some clear signs that it's time to get professional medical help?
That's a great question. And the guide actually lays out some really helpful guidelines for figuring that out.
Perfect. All right, give us the rundown. What should we be looking out for?
Well, the guide says one thing to watch out for is if the pain is like really bad.
Yeah.
And it's not getting any better after a few days of trying those home remedies.
Right.
That's definitely a sign to call the doctor.
Yeah, unrelenting pain, that's usually a sign that something more serious is going on.
Exactly.
What else?
Another big one is if you're having a lot of trouble walking.
Oh.
Like if putting weight on your ankle is just excruciating, or if it feels like it's going to give way every time you take a step.
Oof, I can imagine.
Yeah, not good.
Yeah, I mean, even if it's not a super serious sprain,
Right.
you don't want to risk making it worse
Right.
by pushing yourself too hard.
Exactly. And on that note, the guide also says to pay attention to whether or not you're seeing any improvement.
Okay.
So if you've been doing all the right things, rest, ice, compression, elevation, taking pain relievers, but your ankle is still just as bad after like 5 to 7 days,
Yeah.
that's definitely a sign to get some professional help.
Okay, so pain, trouble walking, No improvement.
Mm-hmm.
Those are all red flags. What about visible deformities?
Oh, yeah, that's a big one.
I feel like I've read somewhere that that's a really bad sign.
It is.
Like, what does that even look like?
So if you see any major changes in the shape of your ankle, like weird bumps, or if it looks like the bones have shifted out of place,
Yikes.
yeah, that's a clear sign to get to the doctor ASAP.
Okay.
Those kinds of deformities could mean you've got something more serious going on, like a fracture or a complete ligament tear.
Oh, wow. Okay, duly noted. So those are the red flags to watch out for.
Yep.
But let's shift gears a bit now and talk about recovery.
Okay, yeah.
I'm sure a lot of people listening are eager to know how to get back on their feet as quickly as possible.
Right.
So what does this Arabic guide recommend for recovery? Especially for those of us who, hopefully don't need surgery.
Well, first things first, the guide emphasizes that how long it takes to recover really depends on how bad the sprain is.
Yeah, makes sense.
Mild sprains might heal in a few weeks, but severe ones could take months.
Oh, wow.
So patience is key here. Trying to rush the process can actually backfire.
That's a good point. You can't just expect to bounce back overnight from a serious injury.
No.
It takes time for those ligaments to heal and for the muscles to get their strength and stability back.
Exactly.
But, while patience is important, there's got to be things you can do to help the healing process along, right?
Absolutely. Remember that rice method we talked about?
Yeah.
Those principles are super important for recovery, too.
Oh, so those initial self-care steps actually play a big role in the long-term healing process.
They really do. They're like the foundation for a smooth and successful recovery.
Got it.
And then, as the pain and swelling start to go down, you can slowly start doing some gentle range of motion exercises just to prevent stiffness.
So it's all about easing back into things, not pushing yourself too hard too soon.
Yep, that's the key.
Okay.
And once you've got some basic mobility back, that's when physical therapy really comes in.
Gotcha.
The guide really stresses how important it is to follow your doctor or physical therapist's instructions carefully. They'll put together a personalized plan to help you regain strength, flexibility, and stability in that ankle.
So it's like having a customized roadmap to recovery.
Exactly. It's not a one-size-fits-all approach.
I like that.
Your physical therapist will assess your individual needs, and then they'll design a program that might include exercises using weights, resistance bands, all sorts of tools to gradually increase your ankle strength and range of motion.
So you're basically rebuilding those muscles and ligaments from the ground up.
That's a great way to put it. And as you progress through your physical therapy, you'll start to notice your ankle getting more stable, and you'll be able to do everyday stuff without pain or discomfort.
That's awesome.
It is.
It sounds like a slow and steady process, but ultimately a really effective one.
It is.
All right, so let's switch gears again
Okay.
and talk about prevention. After all, nobody wants to go through the pain and hassle of an ankle sprain in the first place.
No, definitely not.
So what does the guide recommend for keeping those ankles healthy and strong?
Well, surprise, surprise, proper footwear is key.
Ah,
I should have known.
remember how we talked about poorly fitting or the wrong shoes being a major risk factor?
Yeah.
Well, the guide really stresses how important it is to choose shoes that provide good ankle support, especially if you're doing activities that put a lot of stress on your ankles, like running, jumping, playing sports.
So no flip-flops for my next basketball game.
Probably a good idea.
Okay.
And speaking of sports, the guide also emphasizes the importance of warming up properly before any physical activity.
Taking a few minutes to do some light stretches and exercises that target your ankles can make a huge difference.
So it's like giving your ankles a heads up
Yeah,
that they're about to be put to work.
exactly. Warming up increases blood flow to those muscles and ligaments, making them more flexible and less likely to get injured. And it doesn't have to be anything complicated.
Yeah.
Just simple ankle circles, toe touches, calf stretches, that kind of thing.
So a little bit of prep work can go a long way in preventing those sprains.
It really can.
Okay, good shoes, warm up. What else?
One more thing, and it might seem obvious,
Okay.
but the guide stresses the importance of paying attention to your surroundings,
Right.
being aware of uneven surfaces, obstacles, potential hazards
Yeah.
that can help you avoid those sudden movements that can lead to a sprain.
So it's all about being mindful of where you're stepping.
Exactly. A little bit of awareness can go a long way in preventing those unexpected ankle rolls.
Right. An ounce of prevention is worth a pound of cure.
There you go.
All right. Well, we've covered a lot of ground today, from causes and symptoms to treatment and prevention.
We have.
What stands out to you as the most important takeaway from all of this?
You know, for me, it's the emphasis on understanding how different ankle sprains can be,
Right.
and then tailoring your approach based on that. Not all sprains are created equal, so knowing the difference between a mild sprain and a severe one is crucial for figuring out the right treatment and setting realistic expectations for recovery.
Totally agree. And I love how this guide gives us both practical advice and a deeper understanding of how ankle sprains actually work.
Yeah, it's great.
We've talked about the importance of wearing the right shoes, warming up, strengthening those ankles, but we've also dug into the science behind why those things matter.
It's all about giving you the knowledge and tools to take control of your ankle health.
Well said, well said.
You got this.
And speaking of taking control, I think there's one more piece of the puzzle we need to talk about.
Oh.
The mental side of ankle sprain recovery.
Ugh. Yes, the often overlooked but equally important mental and emotional aspects of healing.
Exactly. Because it's not just about fixing the physical injury, right? It's about dealing with all the frustration, the setbacks, the emotional roller coaster that a sprain can bring.
It's true.
And I can only imagine that those negative feelings can actually make it harder for your body to heal.
Absolutely. It's all connected. If you're stressed or feeling down, your body's ability to heal can be compromised.
Wow.
So it's crucial to address those mental and emotional aspects of recovery right alongside the physical ones.
Okay, I'm all for that. But how do we actually do that?
Right?
What are some strategies for staying positive and motivated when you're stuck with a bum ankle? Or really, any injury that throws you off your game?
That's a great question. Now, the Arabic guide we're using doesn't specifically address the mental side of things,
Okay.
but we can definitely extrapolate from its overall approach to health and well-being.
I'm intrigued. Lay it on me. How do we stay mentally strong during recovery?
Well, I think the first thing is acknowledging your feelings, you know?
Yeah.
Don't try to just brush off the frustration or sadness or even anger you might be feeling.
Right.
It's totally normal to have those emotions when you're dealing with an injury, especially one that disrupts your life.
Makes sense.
So it's like giving yourself permission to feel those things without judgment.
Yeah. So feel your feelings, but don't become your feelings, right?
Exactly. Bottling them up is just going to make things worse.
True.
Let yourself feel them, process them, and then move on.
Okay.
Don't let those emotions consume you.
Got it.
Yeah.
So acknowledge those feelings, and then what?
Then try to shift your focus to what you can control.
Okay, I like that.
Focusing on the things you have power over can be really empowering.
Yeah, for sure. So what kinds of things are we talking about here?
Well, let's say your ankle sprain is keeping you from playing your favorite sport, right?
Right.
Instead of dwelling on what you can't do, why not explore other activities you can enjoy? Maybe try a new hobby, catch up on some reading, spend more time with friends and family.
Yeah, it's all about finding those silver linings, right?
Yeah, exactly.
Finding those little things that can bring you joy, even when things are tough.
It's about adapting and finding new ways to stay active, physically and mentally.
I love that.
And speaking of connecting with people, don't be afraid to reach out for support. Talk to your friends, your family, maybe even a therapist if you need to.
Yeah, sometimes we forget how powerful it can be just to talk things out.
Right.
It can really help you process those emotions and see things from a new perspective.
It's like that African proverb, if you want to go fast, go alone. If you want to go far, go together.
I love that.
Teamwork makes the dream work.
For sure. And I think it's also super important to remember that setbacks are going to happen.
Oh, yeah, absolutely.
Recovery isn't always a straight line, you know?
Nope.
There will be ups and downs.
Definitely.
The key is to not beat yourself up about it. Acknowledge those setbacks, learn from them, and just keep moving forward.
It's a journey, not a sprint.
Exactly.
And with the right mindset and a good support system, you can totally navigate that journey and come out stronger on the other side.
I love that. So there you have it, folks. We've explored ankle sprains from a unique Arabic perspective.
We have.
You now know how to recognize the symptoms, take care of yourselves, and when it's time to call in the pros.
And don't forget, it's not just about the physical healing. Taking care of your mental and emotional well-being is just as crucial.
Couldn't agree more.
We hope you feel empowered to protect those ankles and approach recovery with a positive, resilient spirit.
Yes, we do. Until next time, keep diving deep and keep learning.
See you on the next deep dive.
Catch you later.